But we are here today in favor of a redraft of House 1149, which is a bill that seeks to protect the integrity of the emergency 911 ambulance system, and to map out what the next steps will be in getting this legislation passed. Because to stress, Bob DePoli, Chief, who was saying this is an important step that we had yesterday with the leadership of Mike Costello, the leadership of Senator Petroselli. Yesterday, this bill received a favorable report out of Financial Services, which we're very excited to report today, but there's a lot still to come. To stretch the bullying analogy, by the way, a recent decision by Blue Cross Blue Shield. The reason why we are here is back last March, Blue Cross Blue Shield, then followed by Tufts, decided to change the way that ambulance services are paid. Indeed, to try to force people, either companies or to force municipalities to join their network in a clever business method that they said, join our network or we won't pay you directly for your services. Indeed, they started by paying 2 patients back in March. I'm told by Vinny Dinucito's here too. Vinny, thank you. Vinny, who also was very helpful in making sure that we had this bipartisan support to get many signatures for the bill. Thank you, Vinny. Now, this change of policy threatens the quality of our emergency care. Direct payment to patients of ambulance services has been proven to create a reduction in payments back to our cities and towns, which is why so many of our fire chiefs are leading this issue. Kevin Robinson is going to talk in moments just about how this change, often patients who get a payment are unable to pay or frankly don't pay, and we lose some 40% of our revenue, if not more. I want to emphasize, by the way, I know we have representatives from Mass Municipal who are here. Kevin Pecos, who was the town manager for Foxborough, testified at an earlier hearing that this change of policy could cost his community some $600,000. Indeed, he talked to each of our legislators saying that he was grateful for what we did to try to plan design and how that was going to help him for insurance costs. But he said that would save him about $200,000. He thought that this change was going to cost him around $600,000. His testimony is backed up by Marshfield Town Administrator Rocco Longo and the Town Manager for Situate, Trish Vicasi, both of whom will give comments later today to the press who would be interested. In addition, by the way, direct payments to patients, something that we came through in earlier testimony, it provides an instance of fraud where people who are frequent flyers, each of the chiefs know that there are some folks who just love the excitement of getting an ambulance ride, who will call on a regular basis. But now that there's an even more devious profit motive for someone to call, if they know every time they call and feign having some kind of heartache, they know what a country. They can get $800, $900, that could be a payment for having an ambulance ride. And indeed, we had testimony from then Senator Warren Tolman and Senator Catherine Clark of concerns that folks who have drug addiction would use this just as a convenient way to try to get a check every month. By the way, something that I believe Kevin will touch upon is direct payment to patients. It creates a scenario where we're going to have our communities will now have to sue their own residents for payment. Either residents who decide that month they have to pay their mortgage, or they have some other bill to pay, they frankly just might not make the payment. So then we have a possibility of us having to sue each of our residents. I've already spoken to the clerk magistrate for Quincy, Arthur Tobin, who said that this is an unnecessary and an unwelcome new change that would overwhelm the courts. By the way, Blue Cross Blue Shield, they promised that this new policy would be enacted only to patients of private ambulance companies and not for municipally operated services. Their argument is not persuasive, and indeed our committee found it not to be persuasive. The cities and towns that employ private ambulance companies, and Michael, you educated us on this as far as profit, that they will face reduced quality of service and or increased costs from their private insurance companies, companies that are already operating on a very thin margin. Even though Blue Cross was saying they wouldn't make these charges to the municipalities, we know that this pay-the-patient policy would, without legislative action, it would impact our municipally operating services as well. So, to address this situation, the bill that we execed out yesterday does 3 things. Number 1, it will outright prohibit the pay-the-patient policy. It helps to ensure rapid emergency response, so we won't be losing the ability. Chief Judge from Situate, who was talking to me about how the concern would be, is it would slow down our ability to have rapid emergency response. This bill, it applies only to 911 emergency services, which Kevin will detail how many are done in the state every year. The second thing that this bill does is it addresses the universal concerns, and Mr. Chairman, I know you and I were talking about health care cost containment. This bill has cost containment. Blue Cross Blue Shield has spoken out in the past against this bill. They have it wrong. We have a cost cap here, as folks will see with the legislation, and Kevin will explain more fully, is that this bill will make sure that the payment does have a cap. That cap will be determined by the city or town where the ambulance run originates. Finally, the legislation will outlaw balance billing, a major concern for consumer protection, which is something that I know Ron and I had addressed before, David as well, is to make sure that if there's a difference between what the ambulance service has stated the cost will be and what is going to be paid by this cap, we don't want our individual consumers to be balance billed or charged for that difference. As a final comment, today the governor is going to be releasing his budget. And we all know how important it is for us to protect local aid. This, first and foremost, really is a way of protecting local aid, as every one of our chiefs would speak and all of our local officials. Without this bill, we're going to see major cuts in the funds that we have to do our most important public service.